Welcome to the Coronavirus Update Show. You know, it's been a minute since we've done this show, Nikki.
It has. We're a little rusty. Even though we do the morning show, it's a little different.
Here, you know, saying good evening, everybody. Welcome to the Coronavirus Update Show. My name is Omari, Salisbury, and I'm joined by the ever capable and amazing and super diligent producer, Nikki Barron. How are you, Nikki?
I'm good. I'm happy to be back doing the show after a couple weeks off.
Yeah, well, it's good. It's good to have you back. The audience missed you. You know, there's been a lot going on in the world of COVID since we last checked in. There's also been a lot going on in Seattle since we last checked in. You know, Converge Media is a pretty small operation we're running over here, and sometimes, you know, we don't have a lot of resource. But I'm glad our resources are back aligned to be able to cover this very important topic of COVID and how it's impacting not only our community, our city, and our country.
Yeah, definitely. And it was a little rough, you know, coming back into the topic. I'm a pretty private person, but, you know, I'm okay to say, like, I lost my grandmother and her brother recently to COVID, and they're in Texas, which is a whole other thing without electricity and without water access. You know, so things are a little crazy. And so it was a little bit hard for the last couple of weeks to get into this topic, but I feel called to it even more than ever because of, you know, it's touched me personally so many times in the last year that it brings me a lot of pride to bring this topic back to the forefront. So I'm excited to be back, and we've got the Washington State big dog for our first show back. So I feel like that's a really
big
good
dog.
way to kick it off.
The big dog, Dr. Duchin, back there barking. Woo. Yeah, you know, and I appreciate you sharing that with our audience that you did suffer a loss in your family of COVID-19, and me as well, up in Connecticut. Family up there passed away, and you know, it's this COVID story it's been crazy for so many people. You know, I used to live in Tanzania, live and work there, and the very first COVID-19 death in the Republic of Tanzania was a good friend of mine. And so it's like this story around COVID is, man, it's a lot. But that being said, we're going to focus on the here and now. And the way it's going to go today, for those of you that are new to the Coronavirus Update Show, is the first thing that we do is we check in with the numbers, and then we check in with our guests. That being said, producer Nikki Barron, what's the numbers looking like?
Yeah, so we've got a great little dashboard here that Washington State provides for us that I'm going to get to in a second. But for the numbers, we are at 330,807 total cases. Hospitalizations have hit 18,861. We've lost 4,759 Washingtonians in the state of Washington. And a new number that they're now reporting is the number of vaccine doses that we've given. So we just hit about 1.2 million vaccines here in the state of Washington. So this chart that you're seeing here on the screen is actually our recovery roadmap metrics. So these are the metrics that the state of Washington is looking at when it's talking about whether or not we're going to reopen in these different phases. And so statewide right now, our percent positivity is 7%. And we've seen that goal be, you know, 2% to 4%. So I think the last time I looked, the goal for the state is a 4% positivity rate for tests, which is great to see that 7, because I think, you know, we were up in the 14, 15 statewide just less than a month ago. So it's great to see that most of our counties are getting down closer to that goal of 4%. Our ICU capacity, we want to keep that at 80% or below. So for the state, we are at 81%. So we want to keep masking up, staying home, socially distancing, doing what we can to get that number down, because that's actually the number that is how much healthcare can we offer to people who need it in the ICU. So those are the numbers for today. And as you can see, all of our states or all of our regions, which are not necessarily done by county, but rather by health system, we're all in phase 2 right now. So we're looking pretty good. We've got some hope on the horizon if we all just keep up the good work.
Yeah, you know, the governor just popped it out on everybody. Surprise! phase two.
Yeah.
Which is, I mean, it's good in general. I was talking to some small business owners in hospitality and restaurants, and they're like, "Oh man, we're open now. We gotta go stock up. We gotta go do this and that." Considering it's a bad problem to have, but the whole state's in phase two, which means that we're showing some progress. So we're going to take a short break right now. When we come back, we're going to be talking to Dr. Jeff Duchin from Seattle, Public Health, Seattle, King County. It's like three things. I'm always like King County, Seattle, Public Health, Seattle, King County. And we're going to get the scoop on the vaccine equity, what the numbers are looking like, and what the next steps are. You're watching the Coronavirus Update Show. All right, welcome back to the Coronavirus Update Show. My name is Omari Salisbury. I'm joined by producer Nikki Barron. Before we bring in our guest, Nikki, Dr. Duchin, why don't you tell our audience a little bit about Dr. Duchin and what he does?
So he is in charge of the King County response to the pandemic. So you probably have seen him a lot on press conferences, but he kind of oversees all the moving parts. So he's the big honcho, the big dog, as we like to call him.
It's just the big dog. His title is too long to put on. Like you try making a graphic for this guy, and it's like you run out of space because there's too many words in it. Let's go ahead and bring in Dr. Duchin. Dr. Duchin, welcome to the Coronavirus Update Show. How are you?
I'm doing well, Omari. Thank you, Nikki. And I just want to start by sending you my condolences. I'm sorry to hear about your friends and family members, in particular, that you lost to coronavirus. We're looking at almost 500,000 Americans who've lost their lives from coronavirus since the start of this terrible pandemic. And it's easy to get lost in the numbers and the statistics, but it's hearing you really drives home that each of these numbers represents a person that was loved, that's part of someone's family, friends, coworkers, community members. And I'm just really sorry to hear it.
Thank you so much. Yeah, that really means a lot. My grandmother was a wonderful person, and she will be missed. So I appreciate that.
Thank you, Dr. Duchin. Well, Nikki Barron, I have my questions, right? Like in general, I'm a question kind of person, and sometimes I get questioned out on the morning update show. But Nikki has been waiting now for this edition for you to be here. So, Nikki, I'll throw the questions over to you first.
Great, thanks. So can we just start by giving a quick overview of kind of where we are at for COVID for King County?
Sure. So, we're in a relatively good place compared to where we were a month ago. Our numbers of cases and hospitalizations have been decreasing. Over the past 2 weeks, for example, we've had 141 positive cases per day. Now, that's a decent number, but it's much lower than the levels we had from Thanksgiving through early January. But for some perspective, it's still about 4 times what we saw, at our low point in June. About a third of our cases are still in young adults, 18 to 34 years of age. And, the number of cases we're seeing now is higher than when the governor and I issued our first stay-at-home orders last March. But the trend is going in a different direction, which is great. So hospitalizations and deaths are decreasing, but still not trivial. 2 to 3 people died every day last week. But that's down from 9 a day that we saw around Christmas time. And we are seeing this decrease across all, race and ethnicity groups. But at the same time, we continue to see the disparities that we're seeing across this country from the beginning of the outbreak, with higher rates of cases among Black, Hispanic, and Native Hawaiian Pacific Islanders, higher rates of cases and hospitalizations in South King County compared to white residents in areas of North and Central Seattle. And I'll just give you some examples here. So in King County, if you're Black or Hispanic, you're 3 or 4 times more likely to have a case of coronavirus compared to if you identify as white, 3 and 6 times more likely to be hospitalized. And our Black King County residents are 50% more likely to die, and our Hispanic King County residents are just about 3 times more likely to die compared to whites. And we know this is a entrenched structural problem that's tied to our social determinants of health and systemic racism. And I think we discussed this the last time I joined you. And these problems are something that have been with us for a long time, and which we're trying very hard to address to the extent we can in the context of a public health emergency now with the COVID pandemic. And we have the variant on the horizon. I don't know if you want to talk about that separately.
And I just, you know what? I know you got another question coming, Nikki. I just want to pause right there. Those numbers are shocking.
Yeah.
I mean, it's shocking in a sense that, I got a lot of family down south in North Carolina and South Carolina and things like that. And there's some things there in, rural living and the state of healthcare and healthcare access and quality of healthcare and everything else. But like, I would expect to hear those kind of numbers in other parts of America. And it's just shocking to hear that those are the numbers here in King County.
That's right. Yeah, these disparities are seen throughout the country. They may vary, from one community to the next to some degree, but wherever you look, people of color are more likely to be hospitalized, more likely to die compared to whites. And that also, that corresponds to social vulnerability, neighborhood, access to health care, poverty, you name it, all the other adverse health outcomes that we see associated with social determinants of health are apparent here in COVID. So although they're shocking and they're very disturbing, I have to say, unfortunately, they're not surprising, because we see these types of disparities whenever we have a public health emergency, be it something like Katrina or an infectious disease event. The people who are seeing health disparities every day, routinely in between these emergencies also experience the greatest disparities when these emergencies happen.
That's true, because, we say this is like when the rest of America sneezes, is like a lot of times Black America catches a cold because of all of everything, natural disaster, epidemic, pandemic, all of those things. It's just, these numbers have gotten so massive that it's incomprehensible. I don't think most people can comprehend, moving towards 500,000 people dying and things like that. The numbers are so big that we forget to humanize them in a sense, and it's unfortunate, and that's crazy. And speaking of this now, then, Dr. Duchin, some things that made the news here in the Seattle area and in King County, but also nationally, is vaccine equity. And maybe you can tell us, like, how from your numbers over there, how equitably is the vaccine being distributed here in King County?
Yeah, well, thanks. A critical question. And for those who don't know, you can go to you just Google King County Vaccine Dashboard, and we've got a nice equity map and equity data that you can look at. And I'll share some of that with you, but you can get more data and spend some more time looking at the numbers in detail on that website dashboard, vaccine dashboard for King County. So basically, we're all suffering from this shortage of vaccine, and that we're not suffering equally. So vaccine supply, although it remains the major challenge, is not affecting everyone in this community the same. So let me just start by sharing with you, where we're at overall. We've administered about 400,000 doses all told to King County residents. Almost 300,000 people, nearly 1 in 6 King County residents has received at least one dose at this time. and 113,000, or about a little over 1 in 20, are fully vaccinated. Now, white residents and people who live in North and Central Seattle and Vashon Island have been vaccinated at a higher rate than people of color and people in South King County, particularly given that people of color and people in South King County, as I've shared with you, are at such high risk of infection. This is a problem. So here are some numbers that illustrate the problem. So among all adults 65 and older, because that group is recommended to be vaccinated now, who identify as white, 44% have been vaccinated. And among those 65 and older who identify as Hispanic, 30% have been vaccinated. And among those 65 and older who identify as Black, 24% have been vaccinated. So significant disparities in the proportion of people who have been vaccinated according to their race and ethnicity. And this goes along with the disparities that I shared with you around who is suffering from higher rates of hospitalization and death. The people who are most impacted with hospitalization and death are now also least likely to be vaccinated, right? This is not a good situation. About 50% of people 65 and older living in Central and North Seattle have been vaccinated, compared to 40% of those in South King County. And part of the reason for this is that the way the vaccine program is rolled out nationally, prioritizing healthcare workers, hospital-based healthcare workers, and residents of long-term care facilities, those people are disproportionately white. So a large bolus of the first vaccine supplies available nationally went to those healthcare workers and people in long-term care facilities. So that skewed the numbers right away, away from people of color. But we know also that structural racism, access to vaccine, and also willingness to be vaccinated plays a role here. So we've got quite a lot of focus in our department on trying to close that gap. And I'm happy to say that over time, as we've rolled out some of our vaccine sites in South King County, it makes efforts to preferentially reach out to some of those high-risk communities. The numbers have improved, but we have a ways to go.
Are you finding that the part of the problem is, like, for vaccine access, is that it's been mostly an online sign up, and so there may be language barriers, technology, like access to technology barriers, things like that? Are you seeing the way, like, sort of the mechanisms for rolling out the vaccine from a technology perspective affecting the amount of inequity?
Technology and access to the internet and familiarity with using online appointment services is definitely an issue. Let me share a couple of the things we're trying to do to address this, to focus on getting people who are at higher risk, our older South King County residents and people who live in adult family homes, for example, who don't have access to vaccine sites and the internet and as reliably, and their caretakers. Getting them vaccinated is really a priority. So we have a multi-pronged strategy. We opened those 2 high-volume clinics for South King County residents, people 75 and older or 50 and older who can't live independently with their caregivers. Those sites are in Kent and Auburn, and they filled up through the end of February, which is very good. And as soon as we get more vaccine, we'll open up more appointments there. We also have another partnership happening on the east side. We're working with Microsoft to use the Redmond campus as a vaccination site for high-risk elderly adults who are referred to that site by community-based organizations. And this is one of our strategies, by partnering with organizations in the community who have relationships with eligible, vulnerable older adults, those who have been hardest hit by the pandemic. They will help schedule the appointments for those sites. And these are organizations like the African American Elders Program, the African American Reach and Teach Health Ministry, Lifelong AIDS Alliance, Neighborhood House, and others. So these appointments are really reserved for the vulnerable populations that these organizations work with and help us identify and bring in. And we've also got a community navigator program, which partners with community leaders that represent over 22 language and ethnic groups that help people sign up for appointments, the eligible, vulnerable adults primarily. And then we have this set of equity principles that's also available online that we require our healthcare systems and other partners like Microsoft to agree to in order to partner with us on these types of vaccine activities. So this equity document focuses on making sure that vaccine delivery will go to those who are at highest risk, working with community partners to help connect the population to the actual vaccination services, making sure appointments are available on evenings and weekends, and providing language access. And then finally, our City of Seattle and other regional fire and EMS departments are going mobile with vaccination teams to go into the homes or locations where these older adults are living or housebound adults are living who can't get to a vaccination site. And we're focusing currently on adult family homes and low-income senior housing. And then finally, we're hosting these community-based clinics, some call them pop-up vaccine clinics, again, in collaboration with community organizations. This week we have one for African-American elders with the Central Area Senior Center that's happening. So there are a number of things that we're trying to do to help make people who don't, feel as comfortable with the internet or have access to the internet or speak or read English as proficiently, to help them get access to vaccine right now before those who might be at lower risk get access.
Is there a phone number that somebody can call where they can find out about this information, like a hotline or anything?
Yeah, sure. And if you are wondering how to help someone you love get a vaccination appointment who's eligible for vaccine, it can be really tough. And some of the things we're trying to do now are to provide advice to family members and those who are seeking vaccination. So the first step is, if you're eligible and have a healthcare provider, check with your healthcare provider to see if they're offering vaccine. Many of our community clinics are vaccinating. A lot of our hospitals are vaccinating. Pharmacies are beginning to get vaccine. We don't have enough vaccine right now for all the healthcare providers who would like to offer it. There are hundreds in King County who are interested in providing vaccine, but the supply is way too low at the moment. But we're expecting.
Right. Dr. Duchin, can I jump in right there? I talked to Mayor Durkin yesterday, and I talked to Mayor Durkin 2 weeks ago, and what Mayor Durkin was saying is I think there's only 1,000 vaccines per week or something like that for the city of Seattle. It's a very small number that's allotted into the city of Seattle, and they've been creative in trying to get the vaccines out. You mentioned the pop-up and the job that Fire Chief Scoggins and the firefighters and EMTs are doing. We saw them pop up there, for essential workers in grocery stores and frontline for people working in adult homes. And I'm sure they have more and more pop-ups planned. But in a general sense, people are like, hey, there's not enough vaccine. But when we just drill down in here into Seattle and into King County, can you tell our viewers like how much vaccine we're actually getting per week or per month?
Yeah, sure, Omari. Thank you. Well, I'll give you the numbers, but it's important to understand that when we get a vaccine, no matter how much we get, we look at, again, those communities. We look at the rates of disease, hospitalization, and death across the county to find out where the impact is greatest. We look at the rates of vaccine coverage in the county to find out where we have the gaps, where people are not getting vaccinated and where there are high rates of disease. And then we look at the options for getting vaccine out to those people. Which of the providers can access the high-risk populations most effectively and serve them in the way that they're most appropriately. So among the hundreds of vaccination providers who want to give vaccine each week, we use this sort of logic about where's the disease causing the most damage, where are people not having access, and what options do we have to provide vaccine to those providers who are most likely to reach the high vulnerability population, highly vulnerable population. So for example, each week, in King County, we've received between 11 or 12,000 and almost 50,000 first dose allocations. So that's what people are often interested in. Can I get vaccinated the first time? Our total dose allocations range higher because some weeks we give many doses, second doses to complete the series. So those numbers, they're not huge for the entire county. We've maxed out at just under 50,000 first doses, and most weeks it's in the tens of thousands, 12,000 to 20,000. This week it was really quite low, about 13,000 first doses for the entire county. The vast majority, over 60,000, went to complete the vaccine series in people who had been previously immunized. So as you can imagine, with that's a relatively small number of first doses coming in this week. We expect it to be pretty low next week as well, as many people get the series completed, and the doses that we do get are directed to those people to finish the series. But I'm pretty confident that the numbers will continue to increase after that through March into April. And there will be more providers and more options for people to get vaccinated, whether or not they've had a first doses and second doses.
Right, and I know Nikki has much great. I'm excited to have you here. So I got all these questions. I'm just curious, and not really looking for total numbers specifically, but maybe you can tell us. And when you talk to your colleagues in some of the other counties across the state of Washington, are you able to gauge demand against the actual supply of vaccine? We know that when we looked at other stories across this, we covered other stories across the state of Washington. King County looked like it probably had a higher affinity of people who are more open to the vaccine, or maybe more trusting or whatever the vaccine, than some of the other counties in the state of Washington. When you talk to your colleagues across the state, is there demand for the vaccine in other areas of the Evergreen State?
Yeah, Omari, I think that the supply is pretty limited across the country, and the demand everywhere, I think, is greater than the supply. We are going to reach a tipping point, though, where the demand will become equal to the supply, and then I believe we'll have more supply than demand. And I think one of the challenges will be, not at this time, this is not our challenge. Our challenge is we don't have enough doses. But at one point, I think not too long from now, we'll be having doses and trying to generate more people to come forward for them. And where that's going to level off, where that point of demand is going to level off will probably vary by community to community. As you know, some communities are more interested in vaccination. Some communities have more questions and are more cautious, and it may take more time to come forward. And so, we're going to make sure that the vaccine remains available when people are ready for it. But at this point, we have more people interested in vaccination across the state and across the country than we have doses available.
So actually we had a comment come in from Leon Bernstein, and he said, how do you feel as the person who's actually, in charge of distributing these vaccines, on this local level, about the President Joe Biden making that statement that everybody who will want a vaccine will be able to have it by July? I know I've done the math on what they say they've purchased and how quickly we've been rolling it out. Those numbers don't match up for me. Do you have any other perspective on that statement? Because that feels like a pretty lofty goal that's not there.
I think it's very close to what, by July, we're expecting hundreds of millions of doses to be available, because we'll have additional manufacturers. So we'll have several 100 million doses of Pfizer and Moderna, and then there'll be Johnson & Johnson most likely with other, another 100 million or so by June and July. So, we can't right now, vaccine is only licensed for 16 and older. So we're not talking about the entire U.S. population. And, if you guesstimate, 70% of the population may want to be vaccinated by the end of the summer, I think the numbers are pretty close to what the estimated supply will be. Now, we don't really know what the demand is going to be. That's the big unknown. It may be, I'd be so happy if it was higher than 70%, but I'm worried it will be lower. And there's a lot of other things that are unpredictable about this business. We're anticipating supply and manufacturing going smoothly without any snafus, but look what we're experiencing this week: a snowstorm that prevented vaccine from being delivered here. So clinics had to be canceled because the planes couldn't get off the ground that were supposed to deliver vaccine on Monday and Tuesday. We're hoping they get here tomorrow and Thursday, but there are always unanticipated things that happen. Things go wrong, and you just have to expect that. So there's great uncertainty in every area of this business, but I don't think those predictions are terribly, off base. I think they're realistic. Whether they're going to be accurate or not, well, we'll see.
Right. And, Governor Inslee, like a lot of the other governors across America, wants to get schools back open, kids in school. And man, I guess that's probably a whole nother show what the impact of kids being at home has done. But that being the case, where do teachers fit into this? And one of the things that I saw, Dr. Duchin, and by the way, I forgot to ask you this. We're over time. I know you committed to 30 minutes. Do you still have a few more minutes for us?
Sure, definitely.
I appreciate it, sir. So one of the things that we see is they're like, okay, well, you know what? Schools can reopen certain, of certain age groups and everything else. But then they say that not all schools are created equal. And that, a school in maybe one state or one area that might be new or maybe well-spaced, great new HVAC and everything else doesn't necessarily match up to another school that might be old, might not have ventilation. And there's so many variables that play into that. But I won't go too far down that. But where are teachers at? And how important do you think that it is for teachers to be vaccinated for us to really get school back open, at least the way that it used to be?
Mm-hmm. Yeah, so teachers are considered essential workers. Like so many of our frontline community members who've been out in the community working every day since this outbreak was recognized to do the types of things that we all depend on, transportation, food manufacturing, utilities, mail delivery, people who work in every warehouses and every corner of our manufacturing industry to allow us to continue to function as a society have been showing up for work. They've been at risk. They've tried in every workplace to take precautions, but there has been risk associated. And schooling is no different. Although schools have not been in session and most teachers have not been working and students have been home, schools, like any other place where people come together, will present a risk for transmission, just like all these other workplaces do. And so the most critical thing is to take steps to make that workplace as safe as possible, just like other workplaces do. And so there's a set of very rigorous recommendations, including what I think is very important is this issue of ventilation. You mentioned HVAC. We know that coronavirus, COVID-19, spreads through the air, and it's invisible. And it spreads from people before they develop symptoms, before they look or feel ill. So, your friend, your loved one, your colleague, your coworker can be breathing coronavirus out into the air, and you don't know it, and they don't know it until they become ill. And that's why this emphasis on masking is so important, and the quality of mask that we've recently, been reading about, well fit, filtration, good double layered and snugly fitting is really important. That's critical in the school environment. Doing everything possible that is mentioned in the guidelines to improve ventilation that will dilute those viral particles in the air, screening, for symptoms, separating people. Those things, when done properly, can reduce the risk to a level that's comparable to other, community activities. So that, where we have data, most of the areas where schools are in session did not see rates of disease or spread that was higher than what you would find elsewhere in the community. They weren't like focal points for transmission. Transmission will happen. It can happen and will happen. but it's a question of reducing the risk as much as possible. Vaccination will further reduce that risk, and teachers will be, well, according to Washington State, the guidelines the governor's issued, teachers will be in the phase that includes other frontline essential workers, and the state is now fine-tuning that guidance, and we should hear something, I think, within the next week or two about how all the many different groups, and you can imagine, of those frontline workers, that we've mentioned, how they're going to be sequenced, because there's not enough vaccine for everybody at once. All the people that have been out there, working despite the risk, and the teachers who want to go back to work, and be protected, and the people who've been working, making our food, and in the grocery stores, and in all the other retail that we need for essentials, and for our metro drivers and other public transit and public service workers who are out there interfacing with the public every day. They will be in that category of frontline essential workers. And I just can't wait for the time when we have enough vaccine to get everybody, immunized as quickly as possible, so that we can all return to our jobs and our livelihoods, and be much safer. That said, we still have to take precautions, even if we're vaccinated, for the time being, until enough of us are vaccinated so that this virus is not circulating as widely.
Right. And we're almost out of time here. And so I know I got to throw it back over to my colleague, Nikki Barron. Nikki, what you got?
Yeah, so I just had a question about the variant. So I think it might have been maybe two weeks ago. You were discussing that, even though these numbers are going down, even though we're seeing, positivity rates go down and everything, that there's this danger sort of bubbling below the surface. And I forget the analogy that you used to describe it. But can you talk a little bit about the variants? I know so far, and we've seen the South African variant, we've seen the one from South America, we have the UK variant, and then I was just hearing about another variant today on NPR. So with these variants, can you talk a little bit about those and how they're affecting Washington State and King County?
Absolutely. We need to pay careful attention to these. This is important. These variants, there are many variants around the world, but the one that's of most concern here locally now is the UK, so-called UK, where it was first recognized. It's called the B.1.1.7. This virus is just a new type of coronavirus that reproduces more quickly. It's more contagious, and it probably causes a bit more severe illness as well. And so we're looking at a virus now that is going to be able to spread easier from people, that we will, if we're around someone who has coronavirus, we will be more likely to catch. And so that means our prevention measures have to be better and stronger in order to prevent the spread and to keep ourselves and our communities and our families safe. And what's happening now, which is very good, is that, our overall cases are going down. And these are mostly the coronavirus that's been with us for the past year. But at the same time, recently, this new B.1.1.7 has been introduced. And we know it's around multiple places in the state. It's been found in multiple places in the county. We only test a very small number, so that it's spreading. It's doubling every 10 days. But it's starting at a very small number. So when you start with, 4, 8, 10, and that doubles, 20, 40, 60, 80, it takes quite a number of 10-day periods, weeks or months, until that hits a big number. But once you hit a big number, when that big number doubles, you've got a doubly big number, and so on. And that just keeps happening every 10 days. So we're really worried about what will happen when that virus hits its stride and when it gets momentum. And for that reason, encouraging people not to let their guard down. Don't be falsely reassured by the falling numbers. That does not mean we can relax our precautions, that we should be doing more and not wearing our masks as much. We need to keep up every possible measure, because at some point these new variants are going to explode locally. And to the extent that we can practice these good stop the spread behaviors, we can keep it in check as more people become vaccinated. Hopefully we'll avoid one of these giant waves that most of the European countries have seen, that really led them to complete and total lockdowns for 6 to 8 weeks. And we don't want to go there. We don't want to have to experience that. And we have it in our power to do the things that we know will work But it's going to take some willpower, and it's going to take a little bit harder work than we had to do for the first couple of peaks that we were faced with, because this new virus is harder to interrupt the spread. So more masking, more distancing, less activities. And in particular, once we see these numbers turn around, people will really know it's time to pay attention. I think with the numbers dropping, everybody feels very comfortable. So fingers crossed for now.
Yeah, that gives me a lot of pause when I think about how, restaurants are opening and these businesses are reopening. And so it makes me think like, oh no, like a little bit of anxiety hitting me of like, we're just, this next time it's going to be, it sounds like even harder to flatten the curve next time it peaks, and it will probably peak again. So
yes, I think you're right. It's probably we'll probably see cases increase again, and the key will be to very rapidly adjust our behaviors to respond to that, to prevent that virus from getting hold. Because if it gains the same sort of momentum that the last 2 or 3 peaks did, we will have many more people sick, hospitalized, and die. Our hospitals will be very, very stressed. So we want to make sure that we act early and very, very aggressively if we see these numbers turn around due to the new variant becoming more widespread. And if we're lucky, we'll have enough of our, vulnerable population vaccinated that will avoid, many of those deaths and hospitalizations. But, even the younger, more resilient group, we don't want to see people getting infected with COVID. It's not trivial. There's long COVID. It's a bad disease. And we can all spread it to people who are vulnerable. So we have our work cut out for us for the next couple of months. And I'm hoping at that point, the vaccines will tip the balance in our favors for the long haul.
All right, Dr. Duchin, we could really go on for on and on. There's so many comments, all these other good things that's out here. I mean, we appreciate you spending time and actually going overtime with us. If you could tell us again, or tell our viewers again real quick, like, man, how can what websites should they go to get more information about the latest information from Public Health Seattle King County regarding COVID?
Yeah, sure. So one easy thing to do is just Google Public Health King County dashboards, and you'll get to our page where we have a variety of different types of information all about the outbreak, the numbers, the cases, hospitalizations, deaths. We have a race and ethnicity dashboard where you can look at the number and rates of cases by race and ethnicity and by neighborhood. And then we have a vaccination dashboard where you can look at vaccination coverage by neighborhood and by race and ethnicity, and the numbers that we vaccinated every day, and the proportion of people of different ages who are vaccinated. I think the easiest way to go there is just Google King County Public Health Dashboards and COVID.
They can also follow you on Twitter, right? One of our commenters here said they can follow you on
Twitter. I should have been tagging you. What are you on Twitter?
At Doc Jeff D. Doc Jeff D.
Oh, man, there it is. All right. Well, Dr. D. Yeah, man, I'm getting ready to follow you now. You know what I'm saying? Dang, man. Really appreciate you taking the time and talking to our community and answering a wide range of questions. And as usual, I'm gonna throw it out there. We'll get you back again, right?
Please, I love it. It's my pleasure.
Thank you.
Have a good evening, sir.
Good talking to you.
Bye-bye. Man, this is Dr. Duchin. This guy is he's really easy to talk to about this COVID thing.
Yeah, I can't believe that the show's supposed to be 20 minutes, and but our show always goes over with him. He's just a wealth of knowledge, and it's like also like opening the spigot after I've been sort of like keep my head low on this topic. I'm like, oh no.
What? So we do have a lot of questions there in the comments, and so some of this stuff we'll address. The best thing is a lot of the commenters are regular followers of the Coronavirus Update show. So I think that some of the questions they might have right there, some of them are pretty valid as well, but we're just running out of time. That we're going to be back on Monday, right, at 6:15. And so we're going to, what's one of those big words I can use? Extrapolate questions here, and we'll be able to address some of them. Maybe we'll try something new, a small little question answer session, right?
Yeah, that would be great. I think next time we're having Kevin Schofield. He is working on an article about an increase in nearsightedness in children since the pandemic started. And yeah, kind of what they're seeing, the changes happen to kids from being at home. So it's like an interesting topic.
Damn. If it's not one thing, it's another. All right, producer Nikki Barron, it's good to have you back, even though like you haven't gone anywhere, but it's good to have you back here on the Coronavirus Update show. And I'm sure that our viewers really appreciate you being back in this show, being on the air. And I just want to acknowledge your commitment and your diligence on this very, hard topic that's impacted you so much in a personal way.
Thanks. Oh, yeah, happy to be back. And yeah, it's my 1 year anniversary, so I'm gonna go have some time with my boyfriend and try to relax after all this scary information.
We're good for you. It's like, hey, sorrow follows joy, joy follows sorrow. So hey, go do that and pass my regards to your other half. All right, ladies and gentlemen, Coronavirus Update show. We're getting ready to get out of here. You can join us tomorrow morning at 11 a.m. for the morning update show. Until then, peace.